Now let us calculate the partial pressure of gas, that is oxygen. Now when you consider your air, it's a dry air, dry atmospheric air with oxygen about 21% and 78% of nitrogen, 0.03% of carbon dioxide and other inert gases like helium. Now I can ask you to calculate the partial pressure of oxygen at various levels. For example, I may ask you to calculate the partial pressure of oxygen of dry air. That means the air which is not yet humidified and it is only here in the atmosphere. The formula is going to be fixed whatever the gas is. It is the percent fraction of the gas into atmospheric pressure. So the percent fraction of the gas is 21%. So 21 by 100, I am speaking of sea level. So 760. Why this is important? Or you take for nitrogen 78 by 100 into 760. The percent fraction of the gases, remains constant. So even if you are at a sea level, you are high above, okay, or you are deep high altitude, or you are deep sea physiology, anything, the percent fraction of the gas is not going to change. It is the atmospheric pressure that changes. So at this partial pressure, if you calculate, I think it will be around 149 or 159 mmHg. You can calculate and verify. As you go up, this 760 barometric pressure will go on decreasing. And just imagine, when you are at a high level, which is more than 10,000 feet, and you develop hypoxia and hypoventilation, atmospheric pressure drops. The percent fraction remains the same. So it is the low atmospheric pressure or the low barometric pressure at high altitude that is responsible to decrease the partial pressure of oxygen. Same is for nitrogen. When you go at high altitude, but we are not bothered much with nitrogen when we go at high altitude because we are not using it. But as you go deep sea, what happens? Instead of 760, suppose the barometric pressure increases and becomes 1200. So the partial pressure of the gas will increase. And in deep sea physiology, when you study the decompression sickness, the high partial pressure of oxygen and especially of nitrogen are dangerous because nitrogen, it forms bubbles, right? It forms bubbles, and what it results in the decompression sickness. So get this idea very clear that it is not at all the percent fraction of the gas that is important, but more important is the atmospheric pressure. Now this is with the dry air. Now suppose you inspire this air and the air will get humidified. What will happen? It will be now 21 upon 100 into 760 minus 47. What have you done? You have brought about humidification. So the water vapor pressure, that is 47, have now to be subtracted from 760. So this is of the humidified air. Got this? So this is how it keeps on changing as you go towards deep sea or as you go towards high altitude. But the pressure, the water vapor pressure is going to remain constant. It is not affected. And even there is not much significance of the carbon dioxide, because it totally depends upon the body metabolism. So you go at high altitude, you go at low altitude, is not going to be affected. The water vapor pressure also does not get affected because we are human beings which are able to maintain the body temperature at any varied temperatures of the environment, right? So this is the dry air and the atmospheric air. Now, what is alveolar pressure gradient, and now what is the partial pressure of your gas in your... So how to calculate the dry air and how to calculate the humidified air. Now suppose you are now going to calculate the alveolar oxygen, right, which is also called as the alveolar gas equation, also called as the alveolar gas equation. So dry air, atmospheric air, you have seen that there is going to be the effect of atmospheric pressure in the dry air. And when you come to the inspiration part, you will have to look over to the effect of the humidified air. Now, what happens when you have to calculate the alveolar oxygen or the alveolar gas equation? Same. It is going to be the percent fraction of the gas. FiO2 is the percent fraction of the gas, that is 21 by 100. Multiplied it by 760 minus water vapor pressure, that is 47. Right? The same thing which we did over here. Now, this have to be subtracted by the arterial carbon dioxide partial pressures divided by RQ, that is respiratory quotient. Because when you have got the gas, that is oxygen in the alveoli, it will be subjected also to the presence of carbon dioxide, right? Or carbon dioxide depends upon the body metabolism, that is our respiratory quotient. So this is how you calculate the alveolar gas equation. Sometimes instead of this arterial, you may also be given alveolar in your, in your MCQs. It is okay. Whatever value is given, right? So you don't have to think that alveolar is given, alveoli is given, arteriolar is given. You can take up the value which is given. If it is 2, then you have to take the arterial carbon dioxide level. Now, this is the calculation, and you will see now one more important thing. When you calculate the alveolar gas equation, it comes to around 104 mmHg. Okay, 104 mmHg. But when you take an arterial blood sample, okay, when you take an arterial blood sample, you find that your oxygen is not 104, it is 95, and we take it absolutely fine. Why it is 95? This is because of the phenomenon of what is the physiological shunt. There are certain veins like the Tibian veins, the bronchial veins, which empty their deoxygenated blood, okay, which empty their deoxygenated blood into the pulmonary veins. We know that the pulmonary veins are the only veins which are carrying oxygenated blood. So these Tibian and the bronchial veins, they empty up into the pulmonary veins and they bring about some amount of the venous admixture. They bring about some amount of the venous admixture, and that is what is responsible to decrease the arterial oxygen from 104 to 95 when we take a blood sample, which is perfect and absolutely normal. That means normally can be a difference between the alveolar and the arteriolar oxygen gradient. That is 104 of the alveolar, and oxygen, if we take the range of the oxygen in the arterial bed between 100 to 80, even if you take 95, this normal alveolar oxygen gradient, alveolar arteriolar oxygen gradient should be between 5 to 15 mmHg. It should be between 5 to 15 mmHg because of the fact that though the alveolar oxygen when we calculate is more, but when it comes into the pulmonary, into the systemic circulation, it is subjected to a venous admixture that reduces. So it is absolutely normal. So when you are at high altitude, it is going to be normal. That is between 5 to 15. What is the reason? In high altitude, the oxygen which you are breathing itself has got less partial pressure. And therefore, when you calculate, even if the partial pressure, because the partial pressure is less in the atmosphere, therefore less in the alveoli, and therefore when it comes to your circulation after going through the venous admixture, it is again going to be less. But that range 5 to 15 will be normal because there is no problem in exchange of gas. That is absolutely normal. The only problem is the gas which you have inhaled was of less partial pressure of oxygen. However, you can get an increased in this gradient in conditions when there is ventilation perfusion mismatch, right to left shunt, atelectasis, or any condition where there is impaired diffusion. So this becomes a very, very important MCQ for us. Right? That is the alveolar arteriolar oxygen gradient, which is between 5 to 15, can remain normal or it can be increased. right?